Okay, this was a report that I have shown it to you. Now we can also, doctor can assign a laboratory test and assign surgery. Now we are going to a laboratory test. Name, it's honey. Select patient. You can select any test. These are 2 for samples. You can select blood test or MRI, both. Okay, blood test is fine. Send notification. It will already send to laboratory. Or assign surgery. You can also assign surgery by saying honey. Select. You can select any of heart surgery, kidney stone, etc. Any of the tests. You can assign surgeries. They can also send them notification. Now we are going back to laboratory. I have already I have a account for a lab, but it's a Lara. We have on database. I can show it to you. This one is a Lara, female, this question, and ID and password is lab. Now we can see that there is a notification for us. There is a blood test of this. If the blood test done, or add patient result, then you can add a patient result. This from Lara is a lab attendant, laboratory, and she perform a test and she can update the values also by name, by call honey. Select patient. Patient selected. Blood test. It's a blood test. It's a body temperature. Patient history. Body temperature 37 degrees. Water ratio to ratio 1. Any of the attributes you can save. Submitted. Okay, now test settings. You can add new tests. Like you can add a brain surgery. Added. Now you can add attributes to it also. Like a brain, the test contains mg, like you can say size, brain size, brain weight, etc. You can submit it and you can use it further on. Now this is a patient queue. The blood test is done. Now when we go back to Kelvin, there is a check patient report. These are primary details. These are the first checkup, the laboratory MRI, blood. These are all tests which has been conducted. Okay, now it's the same case with the pharmacy. Just I have to see the ID. Pharmacy is assigned to pharmacy user and password. Fine. There is 2 patients. Patient queue. There are. This one was a. This is a Panadol 250 mg. It is already by patient number 3. In patient number 1, actually the account details and the limitation to every account has been limited because the doctor can access much more reports, etc. He cannot access. That's the problem. Then it's done. It's done. They have a dashboard. They know that they have their queue. The doctor has assigned them. They have a system that this patient will come to buy this one. To pharmacy. Okay. We have a admin also. Type admin, and the ID of password of admin is Jack. Now we will enter Jack. This he can it is a you can add any user and you can delete it. It is an admin panel. He can delete. This is Jeel. He's a doctor. Username, passwords. He can edit his username, passwords. These are doctors. These are pharmacies. These are everyone that who is remembered. So they all our data is here. He can add new directly from here. Admin has a right. Check patient reports. He can check any of the report at any time. Admin has an access. Look, he can select patient and he can details. He can visit all the details. These all the time details, and you can print it directly. This okay. Now one account is left and it is OT, operation theater, like for surgeries. That was, we have a patient queue. Here it says a search surgery. So add a patient results. You can add by name. After an operation, after surgery, you can give any of the kidney stone or any other. You can have a details. You can also add a surgeries, like you have a leg surgery, orthopedic surgeries. You can add it, and after add you can have a leg side. You can have another attribute. Leg side and again. Like wait. These are you can existing surgeries we have. These are the existing surgeries we have, and you can change it that which surgeries are available in which hospital they can hit it. These are surgery values. Kidney stone, like this way. That you can add any attributes, like to when a surgery are giving their report, so they need some attributes as a medical. I'm not concerned with the medical, that's why I don't know that the concerns about attributes. So when it is handed over to hospital, they can do quietly good, and when it's done, it will be removed from here and it will be notified by a doctor.